Hello, I'm Katie Thiemann from the Pennsylvania Medical Society. A new legislative session is underway in Pennsylvania, and we're here to talk about state legislation that impacts physicians. Joining me today is David Thompson, PMed's Director of Legislative Affairs. Hi, Dave.
Hi, Katie.
On February 7th, Governor Wolf unveiled his budget proposal, including several healthcare issues. What are some of the items in his budget that are most relevant to physicians?
Well, let's first talk about the fact that the governor has introduced a budget that is $32.3 billion. It's a little bit of an increase over last year. However, the budget, at least at this juncture, has been well received by most in the Capitol building. There'll be some tweaks here and there. But over the next month or two, this legislature will be looking at the budget. The Republicans, certainly in the House and the Senate, will be reviewing the numbers a little bit more carefully and looking at a whole host of issues that they deem important. With respect to health care, there's certainly one line item that we always watch, and that is the monies allocated for student loan forgiveness for those medical students and residents who want to practice in rural or underserved areas of the state. They have some loan forgiveness opportunities. And the other item that we're looking at is trying to get some money in the budget to put into the prescription drug database program so that operability between the state system and physicians' EMR systems will be a little bit more dovetailed so that physicians do not have to jump back and forth between their EMR systems and the internet to access the database. Okay. So we're going to be looking to have some monies allocated to increase that operability.
Great. So although it's very early in the two-year legislative session, I'm sure PA Med has identified several priority issues. Would you mind elaborating on a few of those issues?
Sure. We have had a number of issues that we had introduced last session. Those issues will again be reintroduced this session. The Society holds a whole host of issues we track every year, anywhere from 400 to 500 different pieces of legislation that we watch. Of those 400 or 500, there's only a handful that we really see moving through the process each legislative session. Last year, we did have a number of bills introduced, sort of as a precursor to this session. They will be reintroduced this year. Those items are prior authorization, streamlining the process so physicians have a little bit more understanding of what insurers are asking for with respect to prior authorization. And also, frankly, the process itself is very cumbersome to both physicians and patients. The other item is credentialing, streamlining the process whereby physicians are credentialed through insurance companies. Telemedicine is a biggie. Clearly, telemedicine is becoming more and more widespread, more used across the state and throughout the country and the world. We want to make sure there's a state statute that addresses telemedicine. Currently, Pennsylvania doesn't have a statute for telemedicine. The POLST issue, physician orders for life-sustaining treatment. It's a new issue for the Medical Society this year in the prioritization list, but it's something that we want to have introduced to help patients and physicians better communicate with end-of-life type discussions. The last issue is a issue that, again, is going to be facing physicians and organized medicine this year, and that is the issue of nurse practitioners and their practicing independently. There's been a piece of legislation introduced most recently by Senator Camara Bartolotta. The legislation is identical to last year's bill, Senate Bill 717. The Medical Society will certainly continue to oppose any efforts to fracture or break up the healthcare team, and the Medical Society just doesn't believe that nurses have the appropriate skill set to practice independent of any physician collaboration or the team-based model of care.
Okay.
So that's it.
Great. Thank you, Dave. Thank you for joining us. You can stay up to date on all news impacting Pennsylvania physicians by downloading your mobile app to the Android or iPhone. Simply go to your app store and search PA Med.